Hello, in this video I'm going to show you a vicious circle that occurs in arthritis. If you have arthritis, or if you know anybody that have arthritis, maybe your parents or your loved one, please pass this video to him or her. This video will help to save a lot of people from this vicious circle. Vicious circle is a cascade of events that happens when there's arthritis in the joints, and this cascade of events worsen the arthritis situation. Remember, arthritis is a joint disease or a joint pathology. There are many forms of arthritis. There is rheumatoid arthritis, there is osteoarthritis, there is reactive arthritis, there is psoriatic arthritis, there is even gonococcal arthritis. Among all these arthritis, the most common form of arthritis in our society today is osteoarthritis and rheumatoid arthritis. Now, if someone has osteo or rheumatoid arthritis or any form of arthritis, there is one common symptom that every arthritic patient presents with, and that symptom is pain. Another common symptom is stiffness. These two symptoms give rise to other cascade of events that worsen the arthritis situation. Look at how it happens. In arthritic patients, there is pain and there is sometimes stiffness. Stiffness is difficulty in moving the joints. Because of pain, the patient will tend not to move the joints. And because the person doesn't move the joints, the pain will get worse. The stiffness in the joints will also worsen. And remember, joint is stabilized by ligaments and muscle. That is what makes a joint to be strong. As you can see, for this joint to be strong, there is a ligament. There are some ligaments and there are some muscles that stabilize this joint. If these ligaments and muscles are weak, the joint will be unstable. The joint will be prone to injury. Now, because of pain and stiffness, the person will tend not to move this joint. And because the person doesn't move the joint, the muscles that work on this joint or the muscle that stabilize the joint will become weak. In some extreme cases, this muscle will atrophy or will waste. That's what we call muscle wasting or muscle atrophy in anatomy or in physiology. Muscle wasting occurs when you don't use a muscle. Muscles are designed to be working. The moment you mobilize your limb or you station your limb one place without moving it, the muscles that work on that limb will become weak, and from weakness they become to atrophy or become to waste. This is another cascade of event that happens in arthritis. Because of pain, the person will tend not to move the joint. The person will restrict his or her activity. And because of activity restriction, the muscles that work on the joint will become weak. In extreme cases, the muscle will waste or atrophy. In this case, one of the limbs will be smaller in terms of size than the other healthy limb. Now, because of muscle wasting, remember what I said, muscle helps to stabilize the joint. If the muscle is weak and if the muscle wastes or atrophy, the joint will be unstable. The joint will be prone to injury. Because the joint is unstable, the person has higher risk of fall. And in elderly patients, fall is dangerous. Falling down is dangerous. It can lead to brain injury, it can lead to fracture, it can even in extreme cases lead to death. Another vicious cycle that occurs is that because the person is not moving the joint stiffness will get worse. Also, the range of motion, which is the movement obtainable in the joint, will reduce. And the pain intensity in that joint will be more. Assuming before this cascade of events started that the pain rating is, let me say, 6. In physiotherapy or in medicine, there is some scales we use to rate pain. We use a numeric rating pain scale to rate pain from 0 to 10. 0 is no pain, 10 is the maximum pain. If, for instance, before this cascade of events started, your pain rating is 6. After this cascade of events, your pain rating might go high. That means that you will have more pain in that joint. Another thing that happens is that because of the high pain rating, the joint will also be sensitive to pain. That is, usually what does not cause you pain in that joint will begin to cause pain. For example, touching you or deep pressure might elicit pain in the joint. That is, the joint will be hypersensitive to pain. Another event that happens is that this will begin to affect your emotional or mental health. It begins to worry you, and this can lead to depression. Also, it can then affect your economic, your financial status. You may now spend more trying to avoid or trying to relieve these symptoms. So this is a cascade of events, and what leads to this event is just pain and stiffness in a joint due to arthritis. How do you avoid this event? The best way to avoid this event is to keep the arthritic joint moving. Exercise have been proven to prevent the advancement or the worsening of arthritic joint, unless your orthopedic surgeon or your physiotherapist instructs you not to move a joint, maybe due to other comorbidities or other conditions. In every form of arthritis, keeping the joint active is one of the most proven ways to relieve the arthritic symptoms or to prevent this cascade of events called vicious circle in arthritis. Also, do well to consult a physiotherapist or your doctor about the arthritis situation. If the arthritis is being managed, if you are exercising, this cascade of events would be prevented. And remember, this cascade of events may make this arthritis to get to the extent that exercises and rehabilitation may not help you apart from surgical intervention, which is very expensive and which in some cases may not be the best option for you, maybe due to advanced age or due to your financial status. So, what am I trying to say? If you have arthritis, make sure you consult a physical therapist, or you can drop a comment on this video. It could help you by giving some exercises you could do to prevent this vicious circle, or we could recommend some treatment option that may be suitable for you. Also, if you check my channel, I have a couple of videos you can do to prevent this vicious circle. I made a video on straight leg raise exercise, which has been proven to prevent and manage arthritis in the hip and in the knee. I also made a video on heel slides, seated knee flexion, isometric contraction of quadricep muscle on a towel, and many other exercises that have been proven to help relieve and manage symptoms of arthritis, which on a long run will prevent this arthritic cascade of events called vicious circle. Please note, this video is for educational purpose alone. Any exercise you see here, make sure you consult a physiotherapist before you start them, or drop a comment here. We could know your medical history before we give you any exercise that is suitable for you. Don't forget to get moving if you have arthritis, or unless otherwise stated by your doctor not to move. Some common movement you can do is just by walking around, trying to take a stroll within your environment or in your neighborhood or your compound. This activity will help to keep the joint active and prevent this vicious circle. My name is Malaki Ifeanyichukwu. I'm a physical therapist. Thank you for watching. Please subscribe to our channel and like this video. Also, hit the notification button. By doing so, you'll be notified whenever we release any of our amazing videos. You can also check our website, www.breezemedicare.co.uk. We have other amazing exercise videos that could help to relieve your various musculoskeletal pains and challenges at home. Thank you.